Our next speaker this morning is Richard Baum, who currently serves as the Acting Director of the Office of National Drug Control Policy. Mr. Baum has served ONDCP for 2 decades in a variety of positions through 4 presidential administrations. His previous role was Director of ONDCP's International Division. Over his years at ONDCP, he has worked both national security and domestic drug policy issues and has been part of the United States delegation to the United States National Commission on Narcotic Drugs. Prior to joining ONDCP staff in 1997, he was a criminal justice writer and researcher and served for 6 years as a congressional staff member. Mr. Baum is also an adjunct professor at Georgetown University's McCourt Graduate School of Public Policy, where he teaches a course on the history of American drug policy. Ladies and gentlemen, Richard Baum.
Well, good morning, everybody, and thank you, Sheriff Champagne, for the introduction and for your leadership as President of the National Sheriff's Association. And thank you also to the board and the executive committee for having me here today. And hello to Deputy Attorney General Rod Rosenstein. I think he just left the stage, but it's great to see him get a chance to get outside the Beltway. It's such a pleasure and an honor for me to be here today with you to represent President Trump as his White House Director of National Drug Control Policy. At the Drug Czar's office, we know what it's like to work for an administration that cares deeply about America's drug problem. We are proud that in a tough budget year, President Trump strongly supported ONDCP and fully funded the HIDA and drug-free communities programs which ONDCP runs. In my second day on the job, I joined President Trump, Vice President Pence, Attorney General Sessions, DHS Secretary Kelly, and other senior officials around the cabinet table to discuss the opioid crisis. He understands how serious a challenge it is all across the country. Just last week, I had a chance to meet again with the AG and Secretary Kelly to talk about how much more needs to be done on both the supply and demand for drugs. Heroin, fentanyl, diverted pharmaceuticals are top of mind, but we are also worried about cocaine, methamphetamine, and the high-potency marijuana that is coming into our communities and threatening the health of our citizens. I can tell you that this issue is not just one item on a long to-do list for them or the president. It is something that they care deeply about. It's personal. We know there's a lot of work that has to be done. And as the DAG mentioned, the number of Americans dying from a fatal overdose each year, over 52,000 in total, really should be unacceptable to us. The president and his most senior cabinet members are committed to turning this around. The Trump administration is also committed to getting a much stronger message out to our young people about the terrible risks they face from using drugs today. Let me state clearly that both drug enforcement and demand reduction are important. Over the last few years in Washington, we have not done a good enough job articulating the critical role drug enforcement plays, both at home and abroad, in restricting the supply of drugs and disrupting the violent drug trafficking organizations. Only a comprehensive approach can help us turn this crisis around. Since I got the job back in March, I've been meeting with law enforcement officials from all over the country. And over the last couple days in Reno, I've had a chance to hear from many of you, and I'm eager to keep this dialogue going. I am in active discussions with the NSA leadership and how we can work together on this problem. We want a close and ongoing partnership with the NSA and look forward to making that happen. The Trump administration appreciates the vital role each of you here and your capable deputies and staffs at home play in keeping our communities safe. The truth is that sheriffs have played a vital role in American life since long before the U.S. was formed. Since 1634, our sheriffs have kept order in our communities. You've responded to the threats we faced, and you've served as leaders and guides for youth. And this role is always evolving to meet new challenges. Today, there is no greater problem facing our country than the ongoing opioid epidemic, which claimed more than 33,000 lives in 2015, 91 people per day. It's clearly an undercount, and our data is a little bit behind the times. It is about 60,000 people dying per year. It's affecting every state and just about every community in some way. I've met dozens of parents who have died in this epidemic, and I've sat with them and heard the stories of their kids and the struggles they had to try and get them help, try and get them treatment, try and get them back on track. And it's heartbreaking to hear their stories, but it's also encouraging to meet so many parents that have committed their lives to try and turn this epidemic around and to use their personal experience to push for better policies and better treatment and better solutions so other families don't have to face the tragedy that they've dealt with. So this devastation is partly due to the increased flow of heroin and fentanyl into the country, as well as the lack of adequate access to treatment. As you all know, and as the DAG also said, fentanyl is a synthetic opioid that is far more powerful than heroin. We're seeing illicit fentanyl, carfentanil, and its analogs being added to other illicit drugs like heroin and cocaine, and they're being pressed into counterfeit pills, which means many people who are ingesting these dangerous synthetic opioids are not even aware of what they're taking. As a result, fentanyl and other synthetic opioids are contributing to this dramatic increase in overdose fatalities. The problems are compounded by the fact that there aren't enough treatment providers in communities across the country, and too many people don't come forward and seek treatment for their addiction. In 2015, there were an estimated 8.4 million Americans who needed treatment for a drug use disorder. Yet 76%, more than 3/4 of them, did not feel they needed treatment and did not seek it. That's right, most people who need treatment are not going out looking for it. And most treatment doctors and counselors are not on the street trying to reach out to those who need help. And these are great people in the health side. They really want to do the right thing, but they generally work business hours and just aren't available 24 hours, finding and seeking and bringing in the people to get them to help before it's too late. And in 2014, out of all the people who entered treatment for a drug or alcohol problem, most weren't referred by a healthcare provider. In fact, a full third of all treatment admissions came from the criminal justice system. And it would be great if we could get them help before they are arrested, and that's something that we're working on, and I'll talk more about that. But once they are arrested and in the system, they need to be directed into treatment. This is an unprecedented public health and public safety problem that has put a lot of stress on you. As sheriffs, though, you play a critical role on this problem. We need your continued strong leadership on this issue. Not to do everything, but to be a catalyst for change, to bring people together to work on better solutions. Too many people are falling through the cracks. Too many moms and dads are burying their kids. This is a real crisis. All of us, including, of course, us in DC, need to up our game and do better for the American people. You're involved in the community. You can engage parents and civic leaders in the response, and you can take steps to help your communities organize better, more integrated responses to this challenge. The National Sheriff's Association has already trained more than 600 deputies and officers to use naloxone in the field. This is critically important because you're saving lives, but it's only a first step. We can't stop there. We need to expand opportunities for first responders, law enforcement, and the criminal justice system to get people into treatment where and when they encounter them. There are some important and exciting initiatives around the country that are making it easier for law enforcement to connect people to treatment, like the Police-Assisted Addiction and Recovery Initiative, or PARI, and the Law Enforcement Assisted Diversion Program, known as LEAD. We also need to expand access to medication-assisted treatment in correctional settings, which we're seeing happening in Rhode Island, Kentucky, and really in many other states all across the country. And we need to make sure they have the proper controls to deliver these medications safely. We need to make sure the justice system is equipped to offer treatment and monitoring at every step. In fact, the supervision that's possible in the criminal justice system can make treatment especially effective. That structure, that drug testing, that supervision, that monitoring is what people really need to get on the right track. Yesterday, I joined the breakout session on medication-assisted treatment in corrections with Sheriff Katujian from Massachusetts and Stephen Amos from the National Institute of Corrections to talk about this vital aspect of reducing drug use in our communities and helping people find recovery so they can live healthy, productive lives. MAT is a critical part of the solution. I commend those who have launched programs including MAT, and I would encourage all of you to consider whether you can do more in this space. It not only helps the inmates with their treatment and recovery, but it also makes jails a safer environment for staff. I want to thank the National Sheriff's Association because so many of you have already stepped up, answered the call, and taken actions in your community. I know that responding to this epidemic has increased the burden on you. And I thank you for all that you're already doing, because without you and other law enforcement officers who are working in the community, working around the clock, this national nightmare will continue to get worse. And that's a key point. Local leadership is critical to ending this crisis. This epidemic is a national problem, but the effects are felt at the local level, in the hospitals, jails, schools, and neighborhoods. So we need local leadership to turn this tide. Of course, we know in Washington we have an important role to play as well. Funding, of course, is often the million-dollar question, and I recognize budgets are tight, new resources are hard to come by, and you have many demands on you and your staff and your existing resources. But thanks to the 21st Century Cures Act that became law in December, the federal government just released $485 million to the states in April to address the opioid epidemic, including treatment and prevention, and another round of funding will arrive next year. That's another about $500 million coming your way. So talk to your states about how this funding can help your communities address this epidemic locally. And look to your regional high-intensity drug trafficking area HIDTA program to help. At ONDCP, as I'm sure most of you know, we provide grants to the 28 HIDTAs across the country that work to reduce drug trafficking in their regions, and we are really proud of their work, the way they're bringing people together, working on the local level, and making sure that there's good communication and intelligence and information sharing. As you know, this is a critical resource to help law enforcement coordinate across the local, state, tribal, and federal levels to address the threat. So if your county isn't part of a HIDTA, we'd be happy to talk to you about applying to the program so you can multiply the effect. We're in this together, and I want you to know the Trump administration is in your corner. The issue of how to get more people to come forward for treatment is something we're giving a lot of thought to in the White House. We want your help, your advice, your input on what you're seeing working in your jurisdictions. The President wants people to be able to get the help they need, and he's taking steps to make that possible. In March, the same day of the cabinet session I mentioned at the start of my remarks, the President signed an executive order establishing the President's Commission on Combating Drug Addiction and the Opioid Crisis. This fall, the Commission will make its recommendations regarding how the federal government can best address this crisis. Just a week and a half ago, the Commission held its first meeting and will release its interim report sometime in July to keep the conversation moving. But we are not waiting. We are already working to crack down on those who seek to traffic these deadly drugs into our country. We are tightening security on the southwest border. I have been to San Ysidro and traveled along a large stretch of the border, so I know it's an enormous challenge, but I also know we can and will do better with securing the border. We are also working hard to stop the import of fentanyl into the country, both on the border and through the mail. These efforts include important work to disrupt the ordering of fentanyl on the dark web and its shipment directly into the United States. We are also working closely with the Chinese to stop the exporting of fentanyl and its analogs. At the U.S. urging, they have banned the export of a growing list of these fentanyl, their analogs, and their precursors, and we're going to keep pushing for more. We're also working in the United Nations to internationally schedule fentanyl precursors. In March, after a strong push by the United States, the UN Commission on Narcotic Drugs voted to schedule two critical fentanyl precursor chemicals, ANPP and NPP. The fact that they're now internationally scheduled substances will help reduce the flow of illicit fentanyl into our country. So we are using all the tools in the toolbox, both supply and demand, to try and make headway against this enormous problem. We're moving forward to address the opioid epidemic, but we can't get on top of this problem without the help and the advice and input from sheriffs all across the country. So thank you for all that you're already doing. And if you can, do more, because this epidemic touches all of us in some way, whether at work or at home. Thanks for everything you do to protect our communities. We look forward to a close, continuing collaboration with the NSA. You can count on us at the White House Office of National Drug Control Policy to be a steadfast partner in this critical national effort. Thank you very much.
Shadow boxing. Get together.